All right, good morning. I have a minute after 10 o'clock. I appreciate everyone joining the call today. Hopefully others will join as well. If not, please know that this meeting is being recorded. Will be made available to you after the fact. And for those who are not on the call, they'll have a chance to listen in to what we talk about today. Just a few items. There is an hour of CME credit attached to this time today. If you will type your name into the chats, Rachel will make note of that, and we'll make sure you get the CME credit. If you don't see that credit within the next week or so applied to you, reach out. Just remind us you are here, and we'll make sure you get that hour of credit. A lot of the talk today, I want to be interactive. If you want to speak up and answer questions, I would really appreciate that. It'll make this time a lot more enjoyable and I think a lot more productive for everyone. If you're not talking, if you would make sure that you're muted so there's not any background noise, that would be appreciated as well. I guess for some of you, maybe you haven't necessarily seen my face or things of that nature. I want to get out and see you and visit with you in person in the very near future. So I look forward to that. Again, my name is John Jones. I'm the Chief Medical Officer for Concord. Really, really appreciate the work that all of you are doing at our sites. My focus for this year, and don't get me wrong, I have multiple focuses, but one of my primary focuses for this year is leadership, and the idea of leadership and leading our programs well, and recognizing that not every program is the same. Sorry, Dr. Sanchez, if you can mute, I think maybe there we go. That's fixed it. Thank you, sir. And recognize that not every program is the same. I do think we have things in common, and we want to hopefully share those common things so that we're leading our teams well. That's the focus of today's talk. I really look for just an introduction to leadership, and then we're going to, through the next couple of years, to be honest with you, touch on different aspects of leadership as we attempt to lead well. I'm going to share my screen, and we will get started. Hopefully this works. Rachel, can you confirm for me that the slide is up?
Yes, sir. The slide is up and it's looking good.
Thank you so much. I appreciate it. I apologize for that little stop sharing down at the bottom there. If I hit hide on that, the whole thing goes away, so bear with me. We'll start with just kind of a brief story as we get started. In 1997, I had finished my family medicine residency and went to a small town in West Texas. I arrived there as the new doc in town. There were 2 doctors already there, so now a 3-person hospital medical staff. On day 2, I was assigned to be the medical director of the local EMS, something I'd never done before. But the doc who was doing it was tired of it and really had no interest in it and said, get after it. I'll tell you that was quite a challenge as a new doctor, trying to find your way in a community and being asked to step into a leadership role. Less than 6 months later came time for chief of staff elections. The 2 guys had rotated it for the last 10 years. And so they said, you're it. Just kind of thrown into, if you will, leadership roles and not necessarily prepared. My guess is many of you may share a similar story. As physicians, when we go to our places of work, we are looked at as the leader. As clinicians on a day-to-day shift, you lead that shift. You set the tone for that shift. And it's not often that going through medical school and all of our training that we actually get leadership training. And so it can be quite a challenge on occasion. I have to read this in the next 2 slides because there is an hour of CME. All planners, reviewers, faculty, and staff involved with this activity have no relevant financial relationships with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients to disclose. This activity has not received commercial support. And this activity has been planned and implemented in accordance with the accreditation requirements of ACCME. Please know that E2O Health and Compliance Watchdog and Concord Medical Group are the folks who put this together for you. I'm going to tell you, I'm the only person who put the content together, and Rachel put the slide deck together, and we have no conflicts of interest today. So we should be good on our hour of CME. Let's move on. Thank you for your patience there. I want to pose a few questions to you. We're not going to answer these questions right now, but I am going to go through them in more detail as we go through the talk today. First, are leaders born or made? I just want you to consider these questions for now. Are leaders born or made? What are the important characteristics of good leaders? Can we become better leaders? What does it mean to lead? Is leadership a title or a way of being? Who's the greatest leader you have known? What made them great? Who's the worst leader you've experienced, and what made them less than desirable? Let's touch on that first question. Are leaders born or made? I'm going to tell you, in preparing for this talk today, I thought, well, heck, I'll just Google some of this and typed in a Google search of examples of born leaders. And I got a nice little list of about 5 people. And then I typed in who are made leaders. And I got a nice little list there, and then recognized that 80% of the people on the list, 4 out of the 5 were exactly the same. And so I'm not sure that AI and Google always give us the right answer. Just sharing that with you today. My answer to the question today, are leaders born or made? The answer to that question is yes. I think both is the right answer. As we consider these thoughts, I'll just touch on a few points of born leaders and made leaders. Those people that are natural born leaders, they have just innate qualities. They have that it factor, if you will. I remember kids even in grade school that, man, that's the kid all the kids wanted to be like. That's the person who led on the playground and led in the sporting events. And it's not like that kid was initially developed skills of leadership. It was just who they were. I was not that kid. To be perfectly honest with you. Made leaders actively develop their leadership skills. They make effort. It's through experience. It's through deliberate practice, and it's continuous education. Maybe you don't have the personality. Maybe you're not an extrovert per se, but that does not mean you can't learn to lead and learn to lead well. It just takes practice and skill and acquiring skills and making that effort to do so. I will tell you, having been thrown into that leadership role with leading EMS and then ultimately chief of staff at that hospital, it required a great deal of study, a great deal of effort to learn to lead and lead well in those situations. Again, I wasn't that kid on the playground with that it factor, so I had to kind of learn some of that as I went. At the end of the day, as a true leader, whether you're born or made, you still need to hone your leadership skills. We can always be better. What are some important characteristics of good leaders? I'm going to tell you, we're going to go into some of that in detail here in a little bit. But before we talk about those characteristics, let's just talk about the difference in good leaders and effective leaders. Just a few characteristics of folks who seem to be good leaders. They have integrity. I think probably we all would agree with that. They're fair. They have a strong moral compass. They set direction and do it well. They build relationships. They foster a team dynamic. They practice ethical behavior. And they leave a positive impression. I think if you look at these things, these certainly are all qualities of people we would want to follow. Someone who treats us fairly, someone who we can trust, they have integrity, someone who sets the team dynamic and builds relationships. At the same time, we can be a good leader, but not an effective leader. People may like us, but we may not get results. So let's talk about some ideals of effective leaders. Effective leaders motivate others. In doing so, it takes some of the burden off of the leader themselves. They empower the team, make tough decisions, They delegate well, adapt to overcoming challenges. And we all know that we're faced with challenges almost on a daily basis. And then we learn to recognize the strengths and talents of the individuals working with us, and we leverage those strengths and talents and put them in a place to succeed. We promote and allow growth to occur in others, and that growth mindset is something we'll touch on here in a little bit as well. And an effective leader delivers outcomes. This is what we're after. To be effective leaders, to get the outcomes that we're trying to accomplish, whether it's with our patients, whether it's with quality metrics, whether it's just in our own relationships with administration, all of those things. We want to provide positive outcomes and be effective in the roles that we're in. And then tangible results, things that we can point to and say, that's the result of what this team did, and that's what this team has accomplished. Those are ideals of an effective leader. I share this with you because you can be good and effective at the same time. Those same qualities of the good leader that we touched on earlier, you don't have to compromise those in order to get results. And so what I'm after are great leaders. What we're after are great leaders. And my guess is what you want to be is great leaders. And to me, that's a combination of being good and effective at the same time. Can we be better? I think it's a pretty rhetorical question, and probably most of you just said, well, that's a stupid question. Of course we can be better. But the answer there is we can always be better. And part of that becoming better is just self-awareness. We need to know ourselves. What are our own strengths? What are our weaknesses? What are our limitations? And then the importance of delegation. When we realize that we have limitations, but someone else has a strength in that area. Great idea to delegate those tasks to that person and get them to buy into those tasks as well. Sometime in the next day or so, I'm going to send you an exercise on self-awareness. It's really for your own self, if you will, but it's an exercise of questions where I want you to consider your strengths, your weaknesses, and kind of your paradigm of life, so to speak. And it's really just a time to be introspective. Many of the regional medical directors have already participated in this. Regionals, if you're on the call, you've already done it. You're excused from a new exercise. But those of you who have not participated, please take the time. The other part of that exercise is I do want you to share that with a trusted colleague. Get their opinion as well. Get their feedback. I think you'll find it valuable. I'm going to tell you there's a time in my life, if someone asked me to do that, I would say I'm way too busy. I've got way too much clinical stuff. This is just fluff and soft topics. But I find that as I've gotten older, I find that as I've maybe had more experience and learned that these type of things are important and they make us more effective in the jobs that we do. So I will be sending that exercise to you. Just look for it and please participate as best you can. I want you to evaluate your leadership qualities. And we want to build on our strengths. We want to work on our weaknesses. While we're doing those things, please don't miss the idea and concept of self-care. You got to take care of yourself. You're important. You're important to your families. You're important to your patients. You're important to your hospitals. Take care of yourself and look out for one another. I would ask you to not judge as you go through that exercise. It's really easy to get negative and sit in judgment of yourself, thinking, well, what are my limitations? Don't be judgmental about it. Just be objective about it. Even you deserve some mercy and compassion. And so what I find sometimes difficult is forgiving myself for mistakes. We need to extend that same forgiveness to ourselves as we do to others. And remember that people make mistakes. And then a reminder that you are people too. So mistakes will come along. So forgive yourself, learn from them, and move along. Can we be better? Another way to be better is practicing our communication skills. We want to practice active listening, be present in the moment, minimize those distractions, and be engaged. Reflect back to the person you're listening to. It's been said that effective communicators listen 80% of the time and talk 20% of the time. A skill that I need to work on is active listening. We want to listen to those who have experience, learn from those who've been there, learn from their mistakes so that we don't make the same mistakes. Learn from their successes so that maybe we can copy and mirror those as well. We want to collaborate with our teams. We want to listen to those that are following. We want to listen to those that we're working with on a day-to-day basis. We want to hear their struggles. We want to realize that we can't always fix every problem the way that they want it fixed, but we need to hear it and take some action on it so that the person who comes to us knows they've been heard. We want to seek feedback. I touched on that a little bit earlier, that self-awareness exercise that you'll be doing. That feedback from others is so important. It's a constant reassessment of what's working, what's not working, what could be better. Let me encourage you to seek feedback from other folks. And then we want to motivate our teams. We want to set clear goals. We want to value their input in setting those goals. We want to provide positive reinforcement, and we don't focus on the negative. Always try to encourage where you can. What does it mean to lead? And I'm just going to come down to a dictionary description here. The word lead is a verb. It means to cause a person or animal to go with one by holding them by the hand, a halter, a rope, using a guiding stick while moving forward. I would encourage you not to use a guiding stick on any of our providers. I do think we can set goals, and we can set targets, and we can set direction and then lead people in that direction. Sometimes we have to take them by the hand. Sometimes they go kicking and screaming. Sometimes it's just a gentle nudge and setting a goal and a target, and those who are motivated will follow the leader appropriately. As the leader, we just want to be there to provide guidance. We want to provide support. We want to provide tools. We want to give opportunities, and we want to challenge others toward improvement. That's kind of the taking them by the hand, if you will, in providing that guidance and directing them in the direction that we're trying to go. Kind of another silly question, is leadership a title or a way of being? Simply by being a site medical director, a regional medical director with Concord, you are in a leadership role. But just having that title doesn't mean that you're leading and leading well. The same can be said for any title that's given. Just holding a title doesn't mean that you're actually leading. I would argue that rather it's a way of being. It's what you do. It's how you carry yourself, and it's the direction you set for others. Some of the best leaders don't even have titles, but simply demonstrate influence, and they inspire others. Some of the best leaders in my local hospital actually are on the housekeeping staff and in environmental services. And I watch the influence they have on other people. They don't have titles, but they lead, and they lead well within their departments and outside their departments as well. So just recognize that just because you have a title doesn't mean that you're actually leading. All right, now it's time for you guys to unmute and speak up. Who's the greatest leader you have known? And I'm going to tell you, while I'm sharing my screen, I cannot see who all's on the call. So please speak up if you will. Dr. Womack, I know I saw your name earlier. If you would start this off, I'd appreciate it. Who's the greatest leader you have known?
Well, not to be flattering, but I would say that you, Dr. Jones, are one of the better leaders I've known. The greatest leader is hard. I think that's almost an impossible question to answer. I could give you great examples. Of course, I feel like the cop-out answer, people would choose religious leadership, such as Jesus and things like that. But I think there is probably a list of folks that have led me and been the greatest leader in my life at different areas and junctures, whether it's your parents when you're a child, or as you venture into, the working world, finding leaders along that. I think the greatest leader is the one that's currently helping you and leading you in the right directions. I think that a better question, in my opinion, would be, can you differentiate between a good leader and a poor one? And are you allowing yourself to be, led by somebody who you do think is a good and effective leader, or do you feel like you're getting taken down the bad road? I don't know if that's the answer you're looking for, but when I read that question, that's kind of more what I thought about.
All right, Blaine, listen, I really appreciate that. You touched on a whole lot of great points there. And yeah, I guess that was the answer I was looking for. Please know that I appreciate the compliment there in the beginning. That was not necessarily what I was looking for, but thank you, sir. Anyone else? Who's the greatest leader you've known? Please speak up.
This is Dr. Harris. I've got a fellow that's coming to teach what I guess you would call customer service in early March that really exemplifies how to lead and how to teach people to lead. And he's going to teach my nurses and the nursing, he's going to teach the management also at the hospital to see if we can't change some things there. To get more patient-centered and more patient-focused so that patients learn how to appreciate what we do instead of us doing things and hoping that they appreciate what we do. And so if you do make that extra effort to do things, then people take that as accountability, and that's a form of leadership. And so he does an excellent job. He has good ratings. I think he was rated by HCA as their top nurse for like 4 years in a row. And he just makes people want to do better. And he's a good friend of mine, and he's who I want to be when I grow up, actually. So.
Dr. Harris, that's outstanding. And I'm glad you're bringing him in to affect your hospital and affect others. Thank you for sharing that. Anyone else? Who's the greatest leader you've ever known?
Hey, I'll make one quick comment. This is Craig Rosenberg. When I first started in medicine, finding real leaders was hard. And I joined a group very much like everybody now with Concord and Dr. Jones. And the person who was leading it was a guy named Jim Johnson. He started it. He was the real leader of it. And he could motivate people. He was your friend. That entire list that Dr. Jones showed at the beginning, he hit every one of those with high marks. And just somebody who, when you say who's a real leader and who can do it, there's different skills. His skill was really about motivating, about getting people together, about making things grow. And he built this huge business that became a humongous management group. And it's all because of his skills. And I think, when you take a look at that list that Dr. Jones gave at the beginning about what it takes to be a leader, when you can check off all those boxes, it makes just a huge difference. There's people who are leaders like, let's say, a Jamie Dimon, or let's say the president of Coca-Cola, or that have grown to high ranks. But it's not the same as that person who motivates, who gets you going, who really makes improvements in your lives and everybody else's life around you. And again, I think that's what we see going on at Concord. And I see that that's the kind of person that I really look up to and think those are the greatest leaders of all time. So thank you.
Craig, thank you for sharing that. And you touched on really the next question here is what made them great. As you talked about Mr. Johnson there, you touched on some of the qualities that he exhibited that made him a great leader. Someone else, maybe not necessarily who is the greatest leader you've known, but maybe what made them great. We'll take one more here. What made that individual a great leader to you?
This is Tio Sanchez Hondo, ER. I was fortunate enough to be a medical student at UT Houston, and that's when Jim Red Duke was still in charge of trauma, still active, still there. And there's one thing about him that always struck me. He was brash and not PC by any means, but the guy created both the EMS and the air vac service. And in my terms, leadership is also fearlessness. He pioneered something, he created something that didn't even exist. He thought differently, thought out of the box, and he made it happen. Now, his style nowadays is not PC. He wouldn't be able to achieve what he achieved because, once again, he cussed every fifth word and he was brash and all these things. And I think that's something that we all need to learn. I've been doing this for 20 plus years, and the evolution of leadership has changed. It's like comparing Patton to General Milley, So I think we have to be cognizant of the differences of how the eras change, the times change, the expectations change, but the fundamental qualities are the same. The integrity, the knowledge, the once again, the fearlessness to endeavor and do things that others haven't done. The ability to motivate and unify people for a common goal. So I personally, like I said, I was blessed to know the man, have lunch with him informally, work with him at the OR, at the trauma bays. But in my mind, that he's a quintessential, typical, what used to be a prototypical leader of a doctor. Once again, now we have a little bit more corporate constraint, and we have to watch our language a little more and be PC a little more. And that's well and good. Time changes. The other thing is, the only thing that's certain in our lives is change. And so once you get used to change, things aren't so bad.
Dr. Sanchez, you've shared some really important points there. I really appreciate you touching on those. The fact that times do change, the fact that the environment changes. We have to lead differently depending on the environment. But then that idea of fearlessness, I'll be honest, when I went through my ideas for this talk, fearlessness is not a word that came to my mind, but now that you've mentioned it, it should be all over this talk, because it does take courage to be a good leader. I appreciate you bringing that up. I'm going to move on now to the next slide. Thank you guys for your participation. There'll be more opportunities. In fact, maybe right now or here in just a second. When we think of the best leaders we've ever worked with, what made them great? A lot of the comments is that they help you grow yourself. Dr. Sanchez, you mentioned Dr. Duke, and it sounds like he allowed you to grow as a clinician, as a physician, and as a leader yourself. Dr. Rosenberg, you mentioned Mr. Johnson, and maybe Dr. Johnson. Forgive me if I'm getting that wrong. But he allowed you to grow into the leader that you are as well. Good leaders help us apply what we've learned. One, they encourage us to learn, and then they allow us to apply it and help us to do so. Good leaders help others to achieve their full potential. If you'll notice here, it's a focus on others. The leader focus is not necessarily on themselves when they're doing it well, but rather on others. Great leaders have an open door. They allow you to come to them with questions. They create an environment of safety. And this is one that's really important to me because I've been in the presence of leaders where it just was not safe to approach them. It just was not safe to ask questions. You would be belittled. You would be made fun of, all of those things. As a good leader, as a great leader, we want to create an environment of safety for our people and an environment of trust. I think those two things go really closely together. All right, I'm not going to ask you to name names here, but I'm posing the question, who's the worst leader you have experienced? My question to you that I want you to answer is, what made them less than desirable? We've all experienced bad leaders. Tell me some characteristics of them that made them less desirable. Anyone just speak up, please.
High achiever that you just can't trust. They're the worst.
Okay.
Mm-hmm.
A lack of trust. They're in it for themselves.
They talk
Dr.
a
Harris, is
wonderful
that
game,
kind of what
and
he's
they're
saying?
all out for themselves, and you just can't trust them to be fair or to be honest with their dealings with you.
Okay. Thanks, sir. Someone else, real quick.
I guess the opposite of that is they don't trust you. There's a lot of micromanagement, overlooking, triple checking when you've never demonstrated that you needed that treatment.
Okay. Micromanaging. Be a good example there. I like that. Thank you. Anyone else, real quick?
Hey, it's Tim Hamburg. Lack of communication. It has to go two ways. If you're going to listen to someone, you have to listen to yourself as well. So communication or lack of it would be it.
Tim, thank you for that. I appreciate that. We'll move on. I think we've touched on some less desirable traits there. Just a few points to be made here. People don't leave companies, they leave their leaders. This is something that seems pretty pervasive these days. It's not that someone leaves, and I'll use Dr. Rosenberg's example. It's not that someone leaves Coca-Cola. They generally leave because of their supervisor, the way that they're treated. If they're not treated with respect and not treated well, they're out and they'll go find somewhere else to work. Maybe just real quick, I'll give you an example of my granddaughter. My granddaughter's 18 years old. She's going to college and she has a job. She's working at Subway, and her manager there treats her well. She thought that she would take a different job and it would be maybe a little easier on her schedule. And she went and worked for a local business that was closer to her home. She got there, and after a week, she realized that the people she was working for were mean to her. They cursed at her. They were constantly on her and holding her accountable for things that they had not taught her to do. She very quickly realized that. And even as an 18-year-old kid said, I don't want to work here. I don't want to work for these people. She went back to the Subway manager and says, hey, can I come back and work for you? And she's working at Subway again. Just an example of people not leaving the company necessarily, but the people that they're working for. It's all in how we treat people. Some studies are out there that show that actually leaders are causing burnout. Employee burnout since 2020, 89% of the workforce reports some form of burnout. And when asked about the causes of that, one of the top 5 causes was their manager and the way they're treated by their leader. The cost of that stress-related absenteeism, which has resulted from that burnout, the cost of that is about $154 billion annually. It's a huge cost to our workforce just because people are burned out, and some of that related to the poor leadership. And leaders themselves are facing significant burnout. About 60% of leadership reports some degree of burnout. And that's exacerbated by not feeling equipped by their organization or supported by their own leaders. And I want to touch on that point specifically here just real quick. Not feeling equipped by their organization or supported by their own leaders. This talk today, this series of leadership experiences and webinars and things that we're going to do over the next several years or few years, is part of equipping you as medical directors. It's not just this professional development program, though. It's the day-to-day. And if you don't feel like you're getting from your regional medical director or from me as a CMO, if you don't feel like you're getting what you need, if we're not equipping you to do your job, that's feedback that we need to hear and I need to hear, because I need to be better about it. If you feel like you're not getting from me what you need in terms of support, I need to know. I need to provide you a safe place to share that with me. And I hope that you're comfortable coming to me with those concerns, because I want to equip you and be part of equipping you, and know that I need to be equipped as well. And many of you offer me support as well, and I appreciate that. But if you're not getting that, especially if you're not getting that from me, I need you to let me know. All right. What's the mission? What are we all about? And I think sometimes this can be 100 different directions, and it's not clearly stated. I went to the Concord website to say, what's the mission of Concord? And I'm not sure I really found one. And so in talking with other leaders, I've come up with a few thoughts on what our mission is, what it should be. And this is the why of what we do. At least this is my estimation of the why of what we do. And I want to share that with you today. I'm going to start with just a brief preview. Concord Medical Group will follow a collaborative approach as we do 3 things. I'm going to be honest with you. The order of these three things has changed for me. Honestly, in the last couple of weeks. And I want to share that with you. In the past, I would have said patient care, patients come first, patients. And I still believe that strongly, that patients should be our focus. But in order to provide great patient care and great patient experiences, our providers need to be equipped to do so. And so as I walk through these three things, I want you to notice the order of them and notice that I've moved patients to number 2. And please understand that my heart's still in a good place there, but I want you to hear what I have to say. 3 things the Concord Medical Group is going to be about. Number 1, we want to provide support and the necessary tools to our providers, which will promote their individual wellness and allow opportunities for them to continually grow and learn in their chosen profession. I want to pour into you so that you can pour into your day-to-day doctors. Give them the tools that they need, make sure they feel comfortable in the job that they're doing, and I want that to be our priority. Because once our providers know that they're important, once you know that you're important, suddenly it makes everything else easier so that we can go to number 2 and provide excellent, high-quality, patient-centered care for every patient every time, while also expressing care and compassion for their families and their friends. If we're going to be successful at this, we have to get the first one right, and that's taking care of our people. And then finally, number 3, to work collaboratively with our partner hospitals to support their missions and their agendas in providing excellent care to their patients and communities. I just want to pause right there and tell you that in the past, number 1 has been number 3 for me. And I've come to realize that I think I've had that out of order. And I hope that you'll recognize that as we move forward, not just in this talk, but we move forward as we work together in serving our hospitals, but serving our patients, but most importantly, pouring into our people. So please know my heart there. Concord leadership. What does a leader at Concord Medical Group look like? This picture on the far right there, that distinguished gentleman, that's Dr. Kyle Sheets. Dr. Sheets is the founder, owner of Concord Medical Group. One of the greatest leaders I've ever met, to be perfectly honest with you. He's a man of integrity. He's a hard worker. He sets a high standard, and I appreciate Dr. Sheets and what he's done for the company. On the far left there, Ashley Bozeman, she's our CEO. Does a fantastic job at leading our company and keeping us growing and moving in the right direction. And there in the middle, that's Steve Kearney. Steve's our chief financial officer. Steve takes care of the money. He makes sure that you guys get paid. He makes sure that the bills are getting paid, that the collections are coming in, and he takes care of the finances for Concord. These are all people of great integrity, and it's a great pleasure to work with all of them. You know, what characteristics do we have? And I hope that we as a company will embrace the ideas of integrity, of being truthful, of setting goals and achieving those goals, but always doing so with right motives and in the right way. Not cutting corners, but always doing the right thing for our people, for our patients, and for our hospital partners. I think we need to be introspective. I think we need to ask as Concord leadership, do we represent those characteristics? Are we always those things? And probably the question is no, because we do make mistakes and we do need to be better. But we need to hold one another accountable for that. And I think that accountability is important. How do we develop synergy among our clinical leaders? That's you guys. My goal in developing that synergy is to, 1, recognize not every one of your hospitals is exactly like all the others. But they do have similarities. And where they're similar, we want there to be a way of integrity, a way of honesty as we take care of our patients and we lead our people in every one of our locations. And that's the synergy I'm looking for, is that we do it and we do it well. Looking for medical directors, all of you, to join me in that initiative. All right, I'm not going to read this slide to you. It's a waste of your time. But there, in my mind, and I've looked at some literature, there are 12 characteristics of excellent leaders. There's probably a lot more, but I'm going to touch on these 12 really quick, and they're going to serve as the baseline. They're going to serve as the premise for education as we move forward over the next few years. Self-awareness, we touched on that one a little bit. You'll get an exercise on that in your inbox sometime later today. Listening and responding, we've talked about communication to some degree already. Coaching, the idea of encouraging others to be better, to show them how to be better, and then allow them to practice that on a daily basis. We want to lead with compassion. We need to care for our people. We want to lead with gratitude, be appreciative of the opportunities we've been given, and recognize that, we should be thankful for those opportunities. Not everyone gets them. The idea of being a multiplier, to grow others, to bring others along with you, is an exciting one for me. I enjoy that aspect of leadership in trying to grow the team, if you will. The growth mindset, that applies to not just bring others along in leadership, but our own growth. Our own personal and professional growth, I think, is a great aspect of leadership. Curiosity, Dr. Sanchez, you mentioned fearlessness. That may play into curiosity, being willing to try new things and look for new ways. We want to create safety. It's going to require some degree of vulnerability and sharing with one another. And that's not just sharing our wins, but also sharing our mistakes, because others should learn from us. I heard something not long ago that we learn in two different ways. We either learn from our failures or we learn from unexpected success. And I kind of thought about that and recognized that, we learn in other ways, but those are two really big ways that we learn. We learn from our failures and we learn from unexpected success. Let me encourage you to share those things when they come along with others, because it's honestly a wasted opportunity for you to be the only one to learn from your mistake if you can share it with others and allow them to learn from it as well. So that's part of that vulnerability aspect. It's tough. That's a tough one. But let me encourage that in you. Also modeling, set the example, show people the way, and then constantly be learning. We can't get stagnant. We can't rest on the fact, well, I've done it this way for 20 years. I'm going to keep doing it this way. Ultimately, that will fail, and we've got to constantly be learning and learning new ways. I touched on this earlier. As clinical providers, you're a leader on your shift. Not always prepared, and my guess is many of you have providers or physicians who work with you that you may get complaints on regularly because they're just not leading well. Remember, they may not have been trained in leadership. They may not have gone through aspects of leadership, and they don't possess that it factor. That's where coaching and counseling from you comes in to help them be better as leaders during their clinical shifts on a daily basis. And I'll touch, having already touched on that, we often put people in a position of giving orders when they're not really prepared to do so. We need to be conscious of that and encourage them in that way. The skills needed for leading and leading well can be taught and learned. Don't miss that. Just because someone is struggling doesn't mean that they're incapable of taking on new information. Share that with them, educate them, and encourage them, and then hold them accountable. Again, I've touched on, we're going to use those 12 foundational principles of excellent leaders as we go through our leadership platform over the next several months and years. The idea is that we take a journey together toward becoming inspiring leaders and developing others to do the same. We're going to focus on those individual behaviors, as I just touched on. We're going to periodically meet about these meetings that we're having now. We may even have individual meetings as well. I'm not going to take up a ton of your time, I promise you. But we want to discuss these topics as they're presented. And we're going to use a lot of different tools. You may see podcasts from Concord. You may see micro learning videos, other relevant content. I promise not to take up more than maybe 5 or 10 minutes of your time each week. Just want you to view these topics as we talk about them. And then finally, we're looking for medical directors to step up and lead their teams well. What is vision? Vision isn't what you do, it's the lens through which you view what is possible and your hoped for end result. We want to not only have mission, that's what we do, but we want to have vision for how we can do it and how we can do it better into the future. So I just want to encourage you in that as well, that we do talk about what is our vision, how can we be better as a company, how can we be better as leaders. I'll just share with you what I believe Concord's corporate vision is, and that's that we want to be the premier emergency medicine and hospital medicine staffing company in the United States. Not just staffing, but staffing and management. I have a vision that we can become the best. We want to be different. We want to set ourselves apart. And this is part of doing that we do it in a different way, that we affect others positively. And in doing so, we'll be successful. We want to always focus on providing support to our clinical providers. I've emphasized that, and I'm emphasizing it again. We want to take care of our people. We also want to provide excellent care and support to our hospital partners. Again, we want to set ourselves apart in this industry in all of those ways. And if we can accomplish those things, everything else will take care of itself, whether it's growth, finances, reputation. If we do those things, we're going to be successful in every way. Most of us just kind of fall into leadership. We're thrown into the position like I was back in Coleman, Texas, and boom, day 2, here you are, you're the EMS medical director. And since that time, it seems like I've been in some position of leadership for 25 plus years now. And many of you share a similar experience. And during those 25 years, I haven't always taken time to reassess, what am I doing? How am I leading? Am I leading well? Have I changed with the times? And so I want to encourage you to take some time out of your busyness to assess those things. That bottom statement there, and I won't read the whole thing, just the last sentence. Leaders can quickly go from being busy and effective to being too busy to be effective. I think we all share this at times. We get so busy in our day-to-day, we don't take the time to consider how can we be better, and are we being effective as we lead others. This is my final slide. As a clinical leader, I am asking you to join me in this leadership journey. I want to do it together. I want to do it collaboratively, and we want to strive to improve ourselves for the betterment of our teams, the teams that we lead, for the betterment of our patients, the betterment of our hospitals and our communities, and at the end of the day, better for the culture that we serve. I know there's been a ton of information, and I've done a lot of talking. I appreciate your participation. If we're going to be successful as a company, I really firmly believe that we have to lead and lead well. And that starts with equipping leaders to do so. I would encourage you that if you're not getting from me what you need, I need to know it. Let me encourage you to talk to your teams. See what they need. See what goals they have. Invest in them. Get to know them. What are their strengths? What are their weaknesses? And then put them in positions to achieve and to be successful. And then take the time yourself to kind of assess yourself in terms of self-awareness and how you're leading and leading well. I would just open it up for comments now. We've got a few minutes. If you have questions, I'm happy to answer them. But I would really love to hear your comments as much as anything, your thoughts on leadership, and maybe a disagreement with something I've said. I'm certainly open to that as well. So I'll just open it up for any comments or questions. Going, somebody's got something.
John, this is Blaine Womack. The only thing I was going to add is that when you send out their self-reflection, the biggest part and the most beneficial part for me was the feedback aspect. One, because I think that no matter what, if you find somebody who's going to be genuinely honest with you, you're going to be surprised by what you hear. I think both positive and negative. You always expect when you ask for feedback to hear what you could do better, but it's also always nice to get confirmation that some things you're doing are working. And so I just highly recommend the people that go through that exercise to not skip that portion of it. Definitely seek that feedback, because I think that in a lot of ways you'll learn how to do better, but you're also going to learn what you're doing is working, and it can kind of make you the better version of your leadership.
Thank you, Blaine. I appreciate that. Anyone else?
Dr. Jones, I'll just chime in if that's all right. I
Matt,
know they tell
please.
us all in medical school that eventually the medicine gets easy, but being a leader and being professional isn't. So I do appreciate that we're taking the time to focus on this, especially as a fairly young company. I think that as we grow leadership forward, this will be a good start for us.
Thank you, Matt. I appreciate that as well. Appreciate those comments. The medicine does get easier. I was working a shift the other day, and I don't know, maybe some self-reflection or whatever, but kind of looked back on all those anxious shifts early on, and how nervous I was, and boy, what patient's coming in next, and oh gosh, I sure hope they're not critical. After 25 years, it's kind of like, well, whatever comes, I'm ready for, and we'll do the best we can. So you're right. The medicine does get a little easier. There are still stressful times. Don't misunderstand that. You all know that. But the aspects of leadership and leading teams and different personalities and different generations becomes tough as well. Anyone else?
And Dr. Jones, this is Tim Hamburg. I just wanted to, thank you for saying the provider first, as well as the patients are just as important. I find that in other companies and other places that I've been, a lot of people stay because of their leader, and they stay in bad conditions, bad pay, bad, multitude of reasons. It's travel, it's far from the house, but they stay for their leader.
In the past,
so by us,
we've all had coaches and people around us that use the expletives and things like that.
Tremendous way.
And we all remember what they said.
Valuing that.
In this PC culture, we can't do that anymore. That's for certain.
Appreciate that.
But the reason they did that in a way was to stimulate dopamine, so we have little markers in our brain as to what they were saying, and we paid attention to it. So the only thing I would say is that I'm trying to do my best to become a better wordsmith,
it's all
so
a work
that
in progress.
when I do explain something to somebody,
just know
or I get their attention, it's with words
it's my priority.
that
and it's
make
the priority
them pay
of
more
Concord
attention.
As well. And
and
when we fall short, we need to know it.
try to get them
to hear
do what we're trying to get them to do,
and we need to
by
correct it in every
impressing
way that we
upon them
possibly
instead
can.
of
So thanks for sharing that.
scaring them to death or
Anyone else?
making them upset at us. So I'm a terrible speaker, but if I learn to speak my words more precisely, I think that that's the best way to go about some of this sometimes.
Dr. Harris, you made some great points there. First of all, self-awareness, right? An area for improvement for yourself. At the same time, we got to get that point across, and we've got to find ways to do it and do it effectively. Times do change, and we've got to choose our words carefully. But I appreciate you bringing that up, and a willingness to work on. areas that we can improve upon. All right, anyone else? Not afraid of awkward silence. All right, I think we'll leave it at that today. Thank you for your time. Thank you for your attendance. I hope this has been worth your time. I don't intend to waste your time. Give me some feedback on what you thought of today, how it could be better, and maybe other topics that you'd like to see talked about. Just know that leadership is a priority for me this year, and investing in our leaders is my top goal for this year and the coming future. At least in my professional life, that's my top goal, is to invest in you as leaders so that your programs can be better, so that you can lead well, and we can affect patient care in a positive way and affect our rural communities and rural hospitals in a positive way, because we're doing things well. I appreciate all of you. If you don't hear that from me often enough, you have my apologies. Just know that I appreciate you and the jobs that you do. They're hard. And I saw an email that Dr. Hamburg sent out to his medical directors. Maybe some of you received it. Words of encouragement to them. I mean, it's February. Guys, we've been through flu season, and we're still in the middle of flu season. And man, it's just getting hard. Encourage your people. And if you need encouragement, let me do that as well. And let me know. Keep in mind, Concord has developed a wellness committee. If you have folks struggling, if you yourselves are struggling, lots of resources with that wellness committee. Another way that we're investing in you as our people. I appreciate your time today. I'm going to close it with that. Everyone have a great day. Look forward to your feedback on this. Watch your inboxes. You'll be getting that self-awareness exercise very soon. Have a great day. I appreciate all of you.
Thank you, Dr. Jones.
Reminder also, if you want that CME, either in the chat or send your name to Rachel. Thank you.